Good afternoon, everyone. My name is Chayanit Ardonk, and today I'm going to present about lumbar disc herniation, automatic detection and classifications based on deep learning sagittal view of MRI. First, for our background, low back pain is a major global issue. Right now, over 80% of all people in this world experience one in their lifetime, and this herniation is one of the key factors for low back pain. Right now, we have an MRI as a gold standard for diagnosing low back pain. However, with a small size of these herniations, radiologists have to work a lot with large volume of image. This can be time-consuming analysis. However, we have an AI and deep learning. Integrating AI with MRI, we can make an automatic image detection. This can help for preliminary screening for technologies and can reduce workload and faster diagnosis and improve patients' outcome. So that's why we aim to develop deep learning algorithm for image-based and real-time detections that can detect determination of 5 lumbar intervertebral discs. Let's go to our method. This is our full work. We divided into 3 main parts. First is data collections and pre-processing. Second, model training. We use a YOLO V5 model for train. This YOLO V5 model is one of the AI algorithm and model testings. Let's start with data collection and pre-processing. We use an open source which consists of 207 low back pain. In total, the data contains 623 MRI scan in sagittal view. For labeling, we use a 6 card of annotations. All annotations are collected and verified by 2 radiologists. Model training, we split data into 80% of training and 20% of setting. And for 80% of training, we do data augmentations so that to improve model ability to detect herniation in various conditions such as brighter or darker scan or when the scan are unclear. And 20% of testing tests undergo validation to evaluate how well the model can detect. For model testing, this is an actual set which represents the image of the testing sets and that have not been predicted yet. And this is a prediction set which is the results for model after making predictions. And the red label show LDH, which is mean lumbar disc herniations with the confidence level behind. As you can see that our model predictions are quite accurate with the confidence level vary from 60% to 80% compared with the original one. For our performance evaluations, our model achieved 95% accuracy of determination and overall accuracy is 96%. And go to our F1 score. F1 score indicates model ability to avoid false positive and false negative. So we have a 96 F1 score. That is mean that our model can indicate the that have ability to avoid misdiagnosing and make sure that our determination are not missed. Additionally, we have our models demonstrate strong sensitivity with a recall of 90.7%. In summary, we have developed a high performance and high reliable model which we aim to apply in image-based and real-time detection. For image-based prediction application, this is an original image or unseen image. If you notice, there will be determination over here, a little over here. And let's see what AI can detect. You can see that AI can detect LDH with lumbar determination over here, and over here. With the confidence level 53 to 74%, it means that our AI can predict it correctly. For real-time detection, I will show you a video of serial sections of MRI. And you can see that when it's passed from frame to frame, the AI automatically detects the lumbar disc herniation shown as a green box over here. In conclusion, our model demonstrates a high accuracy and reliability in detecting these herniations with 95% accuracy and 90.7% sensitivity. However, there is still some room for improvement and limitations. Since we use a small size and no diverse of data sets, and we only focus on central view of image and no grading of herniation severity. So our future study, we aim to perform careful cost variation to ensure the model robustness, incorporating axial view analysis and grading of the AI severity, and also want to compare model performance with radiologist and AI assist workflow. And finally, we plan to develop application or web application, user-friendly application for clinical use to Thai healthcare system to improve accessibility and efficiency in diagnosing lumbar disc herniations. Thank you for your attention. Do you have any questions?
Such an interesting topic. Questions and comments, please.
So I think it's very interesting. It's because of these kind of AIs can apply to the real practice. So what do you plan for like the future clinical application? So like you plan to use this kind of AI in all hospital that have, like orthopedists and, screening all the MRI scanning that come to the hospital, or you go to the low back pain patient? So what do you plan?
For our plan is that we want to, first we have to evaluate the performance of AI in real cipher to make sure that is this work enough to use in clinical use. After that, I maybe we can train our model more for our disease of like MRI. And sorry, what is your question? May I ask again?
I mean that if this AI and you taste in all aspect, and you think that this one is effective for detecting the disc herniation, so do you plan to get every lumbar MRI to go to this AI and screening the disc herniation before the symptom happened, or you would like to do just for the patient come with the low back pain, or what do you plan?
So when I think for the patient with low back pain, we can use this with the technologies when there are no radiologists on site. So technologists can use this to as a screening tool, and then we can tell like radiologists later, and this can reduce radiologist workload as well. Yeah.
To compare sensitivity and specificity of your study to other studies that do similarly internationally, what do you think your performance is likely?
And I say, I think that our model can have a high sensitivity and accuracy. However, with the other, you mean other research, right? Or other model. For other research with they might use different model and different data sets. So, but I think our model still have a very high sensitivity. Yeah.
Is that all for our questions?
Okay, thank you very much.
Thank you very much.